In this video, I want to explore a bold and groundbreaking moment in medical history, the very first successful cesarean section in which both mother and baby survived. Let's dive into the incredible story behind this historic procedure that happened in Switzerland around the year 1500. Let's look into who performed it, how it happened, and why it changed the course of childbirth forever. If you enjoy exploring how medicine has developed through the ages, please subscribe to my channel, Doctor of the Ages. This particular cesarean section was performed by Jacob Nufer, who was a swine gelder or someone who castrates pigs. He performed the surgery on his own wife after she endured several days of obstructed labour. Unfortunately, the efforts of 13 midwives had failed to deliver the baby, so Nufer decided to take things in his own hands. Nufer, given he had some experience with animal surgery, eventually received permission from local authorities to attempt the procedure, although they did initially refuse the request. Some historians do question the story's complete accuracy, as it wasn't recorded until 82 years after the event. But despite this, it remains the first well-documented case of a successful C-section. In the 1500s, C-sections were almost only performed on the mother either post-mortem or when she was considered beyond help. This is because survival was exceedingly rare. Likely reasons for this: lack of anesthesia, antiseptics, and surgical technique. Interestingly, Nufer used his experience and tools from animal surgery, specifically those used in gelding pigs, to perform this procedure. He used a sharp gelding or butchering knife to make a vertical incision in his wife's abdomen, likely running from just above the pubic bone towards the navel. Without any anesthesia, as we can imagine, his wife had to be physically restrained during the procedure. He then went on to cut through the abdominal wall and the uterus, exposing the baby for delivery. After delivering the child, it is believed that Nufer closed the abdominal wound himself, but the exact materials or suturing methods he used are not recorded. In similar procedures of the era, wounds might be closed with basic needle and thread, or even be left partially open to heal by secondary intention. In the 1500s, there was no knowledge of modern surgical techniques, such as laid closure, sterile instruments, or pain management, which we would obviously use today for C-sections. So during his improvised C-section in 1500, Nufer had no access to tools for controlling bleeding. Historical accounts do not describe any advanced methods for hemostasis or bleeding control. Therefore, Nufer likely relied on basic practices common in this era and his experience as a swineherd. These practices would likely include applying firm manual pressure to bleeding areas, as well as working quickly to minimize the duration of bleeding, especially given there were no blood transfusions available at this time. While there is no direct evidence Nufer used ligatures for tying off blood vessels or packing using cloth to stuff the wound, these were rudimentary techniques sometimes used in pre-modern surgery. However, it is more likely that he simply applied pressure and bandaged the wound as best as he could. After delivery, the uterus naturally contracts, which can help reduce bleeding from the uterine wall. Given the leading cause of death now following a C-section is postpartum hemorrhage or blood loss after delivery, he was relying on pretty rudimentary methods to avoid excessive blood loss. Nowadays, bleeding is controlled through a combination of surgical techniques and medication. Oxytocin is a hormone that causes contraction of the uterus, and in the modern day, it can be administered intravenously to stimulate the uterus to contract and control bleeding. Surgeons also still use manual compression to help the uterus contract and reduce blood loss. Careful suturing and double layer closure are both important techniques used today to minimize blood vessel damage, provide additional support, and reduce bleeding. More advanced techniques include balloon tamponade, which is when a balloon is inserted into the uterus to apply pressure to the bleeding vessels and reduce blood flow, arterial ligation, or tying off arteries that supply blood to the uterus, and transarterial embolization, which usually involves a radiologist injecting into a blood vessel in the uterus using a catheter. In rare cases, a hysterectomy or removal of the uterus might be necessary. As we can imagine though, most of these methods were not heard of in the 1500s. Historical evidence also shows that antiseptics and sterile techniques were not introduced until the late 19th and early 20th centuries, and before that surgical procedures, including C-sections, almost always resulted in fatal infections for the mother. Nufer likely performed this operation in a non-sterile home environment, using his butchering tools, with no knowledge of germs or methods to disinfect instruments, hands, or the surgical site. There is no record of him using boiled water, alcohol, or any other disinfectant, nor of wearing gloves or masks. The survival of his wife was an extraordinary exception for the era, as infection was the leading cause of death in surgeries before the invention of antiseptic practices. Nowadays, infection and sepsis is the second most common cause of death post-C-section, after postpartum hemorrhage. So to be honest, Nufer's wife must have been very fit and was indeed extremely lucky to have avoided both of these life-threatening complications. And not only did she survive, she went on to have 5 more natural births, including delivering twins. So in summary, considering this procedure was performed in a non-sterile home environment, using butcher's tools, no pain relief or infection control measures, and no knowledge of modern surgical techniques, it's a miracle Nufer's wife survived. Having more natural births after this was just a bonus. So I hope you found this video interesting and informative. If you did, please do like, share and subscribe to my channel, Doctor of the Ages.